Vaginal bleeding in early pregnancy. Brought to you by Discover Parenting. Bleeding during pregnancy is relatively common and does not always mean there's a problem, but it can be a dangerous sign. Following may be the causes of bleeding in early pregnancy. 1. Implantation bleeding. 2. Cervical changes. 3. Miscarriage. 4. Ectopic pregnancy. Implantation bleeding. In early pregnancy, you might get some harmless light bleeding, called spotting. This is when the developing embryo plants itself in the wall of your womb. This type of bleeding often happens around the time your period would have been due. Cervical changes. The cervix may bleed more easily during pregnancy because more blood vessels are developing in this area. It is not uncommon to have spotting or light bleeding after sexual intercourse or after a Pap test or pelvic exam. Miscarriage. If a pregnancy ends before the 24th week, it's called a miscarriage. Around 1 in 5 pregnancies ends this way. Many early miscarriages, before 14 weeks, happen because there is something wrong with the baby. There can also be other causes of miscarriage, such as hormone or blood clotting problems. Most miscarriages occur during the first 12 weeks, 3 months, of pregnancy and, sadly, most cannot be prevented. Ectopic pregnancy. An ectopic pregnancy is when a fertilized egg implants outside the womb, for example, in the fallopian tube. It can cause bleeding and is dangerous because the fertilized egg cannot develop properly outside the womb. The egg has to be removed, which can be done through an operation or with medicines. Symptoms of an ectopic pregnancy tend to develop in the 6th week of pregnancy but can happen later. Treatment. You may be offered a medicine called progesterone to stop bleeding in early pregnancy. This will only be recommended if you've had a scan to confirm you're pregnant and you've had a miscarriage before. Your doctor may recommend you take the medicine twice a day until you're 16 weeks pregnant. Thanks for watching. Like, comment, and subscribe for more.